Welcome back, everyone. My name is Sarah. Today, we are going to be reviewing the COVID-19 data for CDC Week 30, which is the week starting July 19th, ending July 25th. We had a total of 255 lab-confirmed and probable COVID-19 cases within Jefferson County, which brings us to a cumulative total of 1,150 cases. Our total COVID-19 associated deaths remain at 25 as of week 30. There are currently 11 outbreaks within our long-term care facilities, which has increased since week 29. As a reminder, an outbreak in our long-term care facility population is classified as one or more persons testing positive for COVID-19 in either the residents or the staff. We will start off today by reviewing the data for the entire population for week 30. Then we'll move along to the data excluding the long-term care facility cases after that. Table 1 shows our weekly numbers of lab-confirmed and probable COVID-19 cases, along with our cumulative totals. During week 30, Jefferson County has once again seen our highest weekly case count, with 255 lab-confirmed and probable cases. This is a 50% increase from the week prior. Figure 1, we can see those weekly case count numbers in graph form. This visual shows how our weekly numbers are trending, and as we can see, the numbers in our county are continuing to trend upward. Figure 2, we can see the cumulative COVID-19 weekly case count. The solid blue line shows our cumulative case numbers as time progresses. The dotted blue line shows our trend line, which is that overall pattern of all of our data here. Breaking down the data into those daily numbers, we can see our daily case count and a 3-day rolling average of those daily numbers. This rolling average helps to give us a better visual of how our numbers are moving along. There are going to be days when we have those higher case counts and days when we have those lower case counts. And instead of just going by what those daily numbers say, it's important to look at the overall picture and the overall trend of how those numbers are moving. So our numbers as of lately continue to trend upward. Figure 4, we see the lab-confirmed and probable cases separated out by age group. We continue to see the highest amount of cases in our 20 to 29-year age group with 196 cases. I would like to point out that our school-aged populations, the 0 to 9-year age group and the 10 to 19-year age group, has actually shown the highest percent increase since week 29. These two age groups may not be showing the highest number in cases at this particular point in time, but it is something that we are keeping a very close watch on as we start nearing the start of school. Figure 5 shows our number of hospitalizations that have been reported to the Jefferson County Health Department and the rate per 100 for each age group. The 60 to 69-year age group has the highest total of hospitalizations with 23, and our 70 to 79-year age group is actually showing the highest rate per 100. We are working with the local hospital systems to gather data directly from each system in order to get a more accurate count of our residents who have been hospitalized and or have made emergency room visits. This data in particular is based off of the information that our residents report directly to us. Figure 6 shows us the hospital admissions and a 7-day average of hospital admissions. The 7-day average helps us smooth out some of those high and low spikes that we see with those daily and weekly hospital admissions. The dates that you see at the bottom are the date that the hospital admission was reported to us here at the health department. The reason why it's so important to look at these averages over time is because, again, those daily and weekly numbers do tend to fluctuate. You'll notice that it looks like our hospital admissions start to drop towards the end of your graph, meaning that this past week, we did not have as many hospital admissions reported to us as weeks prior. But before we can confidently say that our hospitalizations and hospital admissions are decreasing, I'll definitely want to see a couple more weeks data in the future to help us determine where that trend is actually headed. Our fatality count from week 29 has not changed. We are still reporting a total of 25 COVID-19 related fatalities in Jefferson County as of week 30. Figure 8 shows our COVID-19 cases by sex. We can see that 58% of the cases occurred in our female population. Next, we will look at our lab confirmed cases here in figure 9. This shows the weekly PCR test results, which means that it does not include the antibody tests or our probable cases. What I like to point out on this particular chart is that dark blue dashed line. This is our percent positive line. We've seen quite an increase in that percent positive lately. So this means that out of all the tests that are being ran, the number of tests that are coming back positive is increasing. Just about a month ago, only 2.7% of our total tests were coming back positive. In week 30, 11.8% of our total tests have come back positive. So that's quite an increase in the past 30 days. Table 3 is where you can actually see those positive and negative test numbers. So we had 237 positive tests out of the 2,005 total tests that were reported for last week during week 30. Table 4, we see our COVID-19 cases by race and the rate per 10,000 residents. Although our white population has the most cases reported with 970 cases, the rates for the Asian and the American Indian, Alaska Native populations are highest. Keep in mind that all of our race data doesn't include that missing or unknown race data. Figure 11 shows our cases by zip code. We are now seeing the highest number of cases in our Arnold zip code, 63010. There were 37 new cases in the Arnold area. Another zip code I'd like to bring to your attention is the 63052 area, which is Imperial. While they don't necessarily have the highest number of cases, this area did have an increase of 36 cases from last week. Next, we look at the COVID-19 cases by zip code per 10,000 residents. This chart does give us a better idea of cases within each area as determined by their individual populations. You can tell that things look a little more even on this chart when we look at the rates instead of the actual case counts per zip code. The Festus area, 63028, has the highest rate per 10,000 residents at this moment. We are also seeing a higher rate there in Cedar Hill, 63016. We did see some long-term care facility outbreaks that were reported to us last week. So let's take a look at the weekly report for our community, excluding those long-term care facilities. Table 1 shows the number of confirmed and probable COVID-19 cases, excluding the long-term care facilities. During week 30, 200 of the cases were in the general population, meaning that 55 of the 255 cases we reported in the very beginning of today's video were within our long-term care facilities. Those cases that are classified as being long-term care facility cases could be within either the residents or the staff of those facilities. But this brings the total cumulative lab confirmed and probable cases, excluding long-term care facilities, to 899 as of week 30. Figure 1 shows that weekly case count number again, this time in our bar graph form. You can see that the past 3 weeks especially have resulted in a significant increase in cases within our general population. Figure 3 shows our confirmed and probable COVID-19 cases and age-adjusted case rates, excluding the cases within our long-term care facilities. When we take out those particular cases, we see that the most cases are still within our 20 to 29 year age group with 180 cases. You'll notice that the rates per 10,000 are much more even across the board. The 50 to 59 year age group has only a slightly higher rate than the rest of the population. Our hospitalization and hospitalization rates by age group show a fairly even split between 3 of our age groups. 14 cases that resulted in hospitalization from our 50 to 59 year age group, 16 cases from our 60 to 69 year age group, and 14 cases from our 70 to 79 year age group. We are seeing a higher rate of hospitalization as age increases, but there are still cases in those younger age groups that are being admitted into the hospitals and emergency rooms. So it is important to take care and prevent illness as much as we can, regardless of age. Lastly, let's look at that zip code data again in Figure 9 to see our COVID-19 cases excluding the long-term care facilities. Our Arnold area 63010 is still showing the highest number of cases with 146. Imperial 63052 is just behind with 136 cases. Bringing us to our last chart for today, we are going to look at the zip code cases per 10,000 residents. Here, you really get that visual that the cases within the community are much more evenly spread out when we take the population of those individual areas into account. Many of our areas have rates in the 30s and 40s. A few areas are seeing lower rates, such as 63023, 63025, and 63069. Which is eventually what we really want to see as the time goes on. Lower rates per 10,000 residents mean less of the population is becoming infected. As we wrap things up here for you today, please remember to continue practicing good hand hygiene and social distancing in order to prevent the spread in our community. Do your best to stay healthy and safe throughout the coming weeks, especially as the positive cases in our area continue to trend upward. Thanks for tuning in today, and I will see you all next week.